Thank you.
When Boris Johnson speaks later on this week, that there's going to be some magical reopening and we're all going to start going out again and shops are going to be full. That's not going to happen. It can't happen. I'll take the medical view on that in just a second. But we've been told enough that there's going to be a staged reopening of the economy, and I'll be speaking to a representative of the beer and pub trade in just a second, as well as taking the medical viewpoint. But clearly, anybody where lots of people get together face to face is going to be difficult for quite a long time. That is a major worry. My question for you, really, this hour, as we all face the fear of going back out in the public again, is, how fearful are you? How's it going to affect your behaviour? But ultimately, which industries should reopen? And specifically, your industry, your job, what's it going to look like when you come back? What do you need to hear from Boris Johnson to reassure you that you are going to be able to survive, quite frankly? 0345 6060 973 is the way to get in touch. Let's get the very latest now. Overseas reporter Charlotte Lynch has all the details. Good morning, Charlotte.
Good morning, Andrew. Yes, this morning we are waking up to that very frank interview by the Prime Minister Boris Johnson. He's been talking in detail about the period he spent seriously ill in hospital with coronavirus, revealing that his health deteriorated so badly a strategy had to be put in place for his death. He's spoken to The Sun on Sunday. He told them it was 50-50 and had to be given litres and litres of oxygen to keep him alive. As we know, he spent a week last month in London's St Thomas's Hospital, 3 of those nights in intensive care, and he says that he kept asking himself, how am I going to get out of this? Now, of course, we know he's back at work, and all attention does turn to this lockdown exit strategy he plans to publish next week. Now, yesterday at Downing Street's daily briefing, we heard the number of people who've died from coronavirus in the UK rose by 621 yesterday, but this figure, of course, now includes all settings, not just in hospitals, so it does look like we could start to be seeing this figure slowly coming down. And we also know that these deaths were just recorded in that time. They didn't all necessarily occur on the one day. And now at the Downing Street daily briefing, Community Secretary Robert Jenrick also announced a £76 million fund to help victims of domestic abuse during the lockdown. This is as calls to the national helpline rose by almost 50% in the last 3 weeks. But there was a lot of talk, of course, around how our lockdown measures might start to be eased, what this roadmap, if you like, that Boris Johnson is set to reveal on Thursday could look like. Of course, there was lots of speculation in the papers yesterday about certain measures that might be introduced there, but some bad news if you think it'll involve going to the pub anytime soon. England's Deputy Chief Medical Officer Jenny Harries has said that things like that will still be too risky.
So if you go as a family unit and sit in one place and you've got the same exposure there that you would in your house at home, that's probably quite a safe environment. If you go with a whole load of friends that you haven't seen from before the coronavirus lockdown, sit in a pub in a very small environment, lean well over each other on the table and stay there for some hours face to face, that's really not a good thing to do. And I think sometimes people will get confused with the activities that they do before the event and then the event itself. The other example, of course, is people all piling into cars together, and that is a potentially high risk. If it's your family unit, you're all exposed to the same as you would be at home. But if you pick up all your mates on the way to the outdoor event, not a good thing at all.
Now, one of the things the government's hoping could lead us or help us to a way out of lockdown is a COVID-19 contact tracing app. Millions of us are going to be asked to download it. So you log your symptoms if you have them on the app, and then it uses Bluetooth to notify other users each time they come within of your device and vice versa. But of course, for it to work, all parties involved in that must have the app downloaded. Robert Jenrick saying at the Downing Street briefing yesterday, he thought the vast majority of people would download it and play their part, and insisted it was just one part of this plan to stop the spread. Now, it says, you mentioned at the start of the programme, a new poll has found the majority of Brits are strongly opposed to lifting the lockdown. A new poll in The Observer suggests that less than 1 in 5 of us want to see schools, pubs and restaurants reopened. Only 17% of people asked think that conditions have actually been met to consider reopening schools. A huge 84% opposed to mass gatherings. So really there's two questions. Firstly, when will we begin to see changes? And second, will people actually be resistant to returning to normal life?
Yes, well, very good question, Charlotte. Thank you very much indeed. Fearful Britons? Well, absolutely. I can completely understand that. Most strongly opposed to lifting the lockdown. Are you fearful about lifting? I wouldn't go to the pub right now. I have to be honest, but given half a chance, I might have a pint or two more than normal. Dr. Michael Tilsley is with me, Associate Professor of Infectious Diseases at the University of Warwick. Dr. Tilsley, good morning to you.
Good morning.
Yes, going out to the pub and all that sort of stuff. Hardly a surprise that people are scared at the moment. This poll that has revealed that about Britons. It's probably a good thing at this point, isn't it, that they feel this way?
Yeah, I mean, I think it's probably not surprising because even though I think we've perhaps all struggled with the imposition of these lockdown measures, actually in the main, and I think this is actually tangential to what you've asked, but I think also really important to stress, people have been in the main really, really good at observing the social distancing measures from my own experience. And I think it's going to take a certain change when measures start to be relaxed. And I suspect within the relatively near future, we will start to see a relaxation of these measures. But I think it's going to take some time before people feel really comfortable. Because, of course, if we look at the data, we're still getting, quite significant numbers of cases reported per day, and unfortunately, just a significant number of deaths. And I think these numbers are probably going to have to decline to really low levels before people feel really comfortable to start sort of resuming their normal lives.
It's been a mantra that we've heard again and again, and I think most people related to it very strongly and followed the advice that we will be led by the scientific advice. We'll be led by the science. As soon as that was said, one knew that we were in for the long haul here. Clearly, anybody that took that information in. But the psychologists are going to be required next, because I think that we all followed the rules more than government thought we were going to. And now we're going to have to get a very strong message to get back out there again. Otherwise, we're going to turn into hermits.
I think it's going to be extremely difficult. And of course, obviously, I'm not a psychologist, so it's very difficult for me to try to predict people's behaviour. But I think it is going to require a real change. And as I said, I mean, there's a lot of evidence that suggests that some of the behavioural scientists have been doing that suggests that, there will be a relatively small proportion of people that will be really happy to resume their normal lives straight away. And I suspect it's going to be incremental. It's going to take time. And as we start to see lockdown measures relax, this is actually the other important factor of this, that it's going to take some time before we see the effect of that. Just as we saw when lockdown was introduced, it took 3-4 weeks before we really started to see evidence that it was working. The same is true with relaxation. I think people are going to be a little bit wary of that when these measures start to be relaxed, that we might see a resurgence. And so it's going to take some time, I think.
Well, we don't have groupthink in this country, and we're not bullied by an authoritarian government most of the time. Anyway, we're not. But we make up our own minds, and people will. And I'm sure everybody's going to be very different. I think a lot of people are going to be extremely stressed going forward as well. But can I ask you for a comment on what I'm reading on the front page of the Times this morning? Set free healthy over 70s, say doctors. Lockdown should be eased for the healthy over 70s, because keeping them inside is damaging their mental health. This is senior doctors, the British Medical Association and the Royal College of GPs put in their names to this call, it seems.
Yeah, and I mean, so this is a really controversial issue. Now, this is the problem, right? That if I'm speaking as a sort of infectious disease scientist looking at the data, it's very easy for me to look at the data and say anyone over the age of 70 or 80 is more at risk. And I mean, that is, looking at the data, that is absolutely true. That's the only thing that I look at. But of course, what that doesn't take into account is that no two 70-year-olds are alike. You know, I mean, my parents are both over 70 and extremely fit and healthy, and I think my mum would be quite offended if I said that I put her in the high-risk group. And I think it's absolutely true. So it's extremely difficult because if you put a policy in place, it's very easy to put a policy in place to say anyone over X age or anyone in this group will have these measures in place. If these policies are in place for the long term, I do agree. I think this is going to have to be looked at because people's well-being is extremely important in this too, and I think we're going to have to consider more bespoke policies that enable people who are fit and healthy to resume their lives.
That's what I'm asking people in terms of their business and personal lives this hour. What do they need to see? I think it's particularly business-wise. What have they got to hear from Boris Johnson? Thank you very much indeed for that. That's Dr. Michael Tilsley, Associate Professor of Infectious Diseases at the University of Warwick. Turning to Emma McClarkin now, Chief Executive of the British Beer and Pub Association. Emma, morning to you. Not many words of comfort from government yet, and the opinion poll in the Observer also suggesting that people are really not ready for your industry to reopen. That's a concern, isn't it?
Well, good morning, Andrew. I've been listening to the conversation, and of course we're not talking about opening pubs tomorrow. We're talking about the possibility of opening pubs under whatever our new normality is going to look like, and basically trying to find out what the pathway is to getting there so that we can develop our own working practices, our own protocols to make our customers and our staff ultimately feel safe inside our pub environment at some point in the future. If, and the big if, is if they can survive the longer period of closure that they will be asked to stay closed for.
Yes, well, this is the problem. What does a carefully phased lifting of lockdown mean for an industry where people have to be face to face, be they working in a pub or the restaurant attached to the pub, or whether it's a customer coming in? You don't go in there some people go in there to sit alone and end up in the bottom of a pint glass, but most people go there to be social, don't they?
They certainly do, and some of our people that go on their own go there because it's the only conversation that they might have in a day. So there is a very much social role that we play, and that's not just about socialising sometimes, it's sometimes literally providing people that place to go and prevent them from feeling lonely. But the reality is that how do we create an environment that allows people to feel safe whilst socialising in whatever the new normality is going to look like down the road in the months ahead.
Exactly.
And this is what we're trying to work with government. I was on a government meeting yesterday, so after 6 o'clock, discussing how we can formulate working practices that make customers feel safe, that make staff feel safe, that control the infection rate, that will be linked, that can be scaled up if there's a spike again, or scaled back or relaxed if we see that there is a drop in infection rates, that allows us to try and get our economy moving. Pubs are businesses at the end of the day. They are places where we go to relax and have fun, but these are people's livelihoods as well, and the longer pubs stay closed, the more support they're going to need from the government if they have any chance of surviving at all.
Are you talking about extending furlough?
Oh, we have to have extended furlough. We absolutely, if we're going to see an announcement of a roadmap that sees pubs closed for a substantial period of time, we're going to need furloughing extended. We're going to need further grants for our pubs from the government. We are going to need extended access to credit and finance, because pubs, their expenses are not fully covered by the government right now. There is an extensive amount of cash burn that's going on, and of course there's only a certain limited amount of cash burn that any one business can sustain.
Completely. Emma, just lastly, how much is the beer and pub sector worth to the British economy? What's the generally accepted number?
We contribute 23 billion to the British economy, and we are 1 million jobs in the UK. So we contribute substantially to the economy, and
also to life, to be honest.
Of course.
Listen, I've got to let you go, Emma. I'm sorry about that.
No problem.
It's Emma McClarkin, Chief Executive of the British Beer and Pub Association. 7:17 is the time. Look, the question is, this is an industry, the beer and pub industry, 23 billion, 1 million jobs. There are industries and many, many sectors that make up an economy, and many a lot bigger than that. But we use this as just one example. This is part of the social fabric of this country. What's important to you about what happens next? What needs to... Is it reopen? Is that the way? Is it unlock? Whatever the word is, what do you need to see? What's your new normal looking like? And what do you need to hear from Boris Johnson? 7:18 is the time. As well as that, we'll be heading over to the United States in just a moment to get the very latest. My goodness me, there's an election this year. Lest we forget that. Let's have a look at the traffic now. Katie, time.
Thanks, Andrew. The M4 is closed in both directions this weekend between junction 5 for Langley and 6 for Slough for roadworks taking place. Only one lane is open on the Seven Sisters Road. That's westbound between Amherst Park and Manor House because of emergency repairs. And in New Southgate, there's flooding on Station Road between the North Circular and New Southgate train station. National Rail services continue to run to a reduced timetable, and on the tubes, the Circle line is suspended. But please remember to only travel if your journey is essential.
This is LBC. This is a message from the government to all essential workers who are doing vital jobs to keep our country going. And you can now get tested for coronavirus. From health professionals to emergency services, from delivery drivers to grocery workers, from teachers to care workers. Tests are available for you and anyone in your household who has symptoms. For a full list of all essential workers eligible and how to get a test, go to gov.uk/coronavirus.
If it's essential that you travel by train this May, here's some important news from us at Network Rail. There are engineering works planned for both the early and late May bank holiday weekends. Some services may change and some will not be running. If you really must travel, please plan ahead by checking nationalrail.co.uk. Working your way through the kids' schoolwork, pretending you always knew the capital of Brunei is Bandar Seri Begawan, when really you're frantically scrolling through the internet with your phone under the table, hoping that they just think you're an absolute fountain of knowledge. Whatever you rely on the internet for, rely on TalkTalk to stay connected. TalkTalk for everyone.
Listen to Raj go. Polyrhythm Paradin. A drum solo so epic. He nearly forgot his mom's birthday back in Delhi. Good thing Raj has Western Union on his phone and can send money quickly online. Download the app today. The service is provided by Western Union. FX schemes apply. This is a message from the government about the emergency measures to support the economy during the period of disruption caused by the coronavirus. To help you, your business, and your workers affected, you can apply for cash grants, business rate holidays, statutory sick pay relief packages, as well as the coronavirus job retention and self-employment income support schemes. For information, go to gov.uk/business-support now. Boundary Castle on LBC.
Just a second, I was listening to a report yesterday on New York City. There's one care home there. I heard the number 100 people have died in a care home. 100 people. And the effect on life on a vibrant city, a city that sleeps. Anyone that's ever walked in New York at night, I mean, there's no place in the world like it. It's just been hammered. I mean, they've been burying people. You've got nowhere else to be buried, no other loved ones. I mean, it happens in every country. There's an awful lot of willow caskets. Some of the side things. Now, over 60,000 people, 65,000 people have died. But it's a smack to the psyche of the United States. Huge changes over here, of course, with technology and with the way we live our lives everywhere in the world. But for America to be hit like this, very, very fundamental. And have they had the leadership? So we'll go to America in just a second and address some of those questions. What I want to know from you this hour, and the number is 0345 6060973, is as we talk about a carefully phased easing of lockdown, what does that mean for you? How in your industry will your job have changed? Is your job even going to be there? What do you need to see to start feeling that optimism again? And we all want to feel it. Now let's talk to Judy. Hello, Judy. How are you? What do you need to see to feel better? Or are you feeling all right at the moment? There's quite a lot of people who are kind of content with a slightly slower life. tennis club, have you?
Yeah, we have, yes. So we're lucky. We've got a little green. There's a little green, and then go from the tennis courts across to we've got our own little pub.
Straight
There's
to
a place as well.
Straight to the from the tennis court to the boozer. It's a journey I know well, Judy. Take care of yourself. All the best. 24 minutes past 7. What do you need to see happening up? Quite interested in your job actually, and how concerned you are that there's not going to be one. that's the thing. Or how would it have changed? And actually, can you do your job if you have to social distance? So what do you need to see from Boris on Thursday? I'll go through the papers in just a second. To America now, though. The total number of US deaths from the coronavirus pandemic has exceeded 65,000 people as of Saturday morning. This according to Johns Hopkins University. Available data now puts the estimated figure at 66,500 deaths, 1,148,000 confirmed cases of COVID-19. Derek Myers, senior reporter for Newsnet. He's in Washington, D.C. Hello, Derek.
Good morning.
Good morning to you. I was saying, you might not have been with us, but I was reading a report on New York, and I was listening to a report on New York and how fundamentally it's been smacked in the face by this. Extraordinary, really, isn't it? And while we've all been focusing on our own kind of markets and our own societies, our own places where we live and hopefully work soon, New York got hit so hard, Derek, my goodness.
Yeah, and as you were mentioning, 100 people have died in a old folks nursing home there, and it's absolutely catastrophic. And there's 700 patients that live there in that center, with now a majority of them have died. It's certainly been traumatic for the staff and the loved ones in that area.
Yeah, I would say so. Yeah, and you had that. This is when you need strong leadership. You've got Donald Trump.
Well, he is the president of the United States, and we have to hope that he has the right people in the place behind closed doors that are telling him the right things to do. You know, we're seeing his election strategy starting to take shape over the last week. Some of the key points that he's doing to get reelected in November, and that's destroying Joe Biden and also fuel hate and anger in the red states where a lot of his supporters are at right now. And those seem to be the two key points. That's typical Donald Trump.
Fueling what? Anger.
And yeah, we are seeing people protest at state houses outside of these governor press conferences. They're carrying around automatic rifles and firearms, handguns. It's just absolutely something to see. And as I mentioned on air yesterday, I don't know what they think. Maybe they think they're going to shoot the virus. I really think it's a scare tactic or intimidation that they have to carry around these large guns when they're protesting.
So this is basically, look, this is the land of individual liberty, individual decisions taken by individuals, big government. These guys on the right, they don't like big government. They like Donald Trump very much. There's nothing that we don't know here. Make America great again, and all the hats and the redneck, the Confederate flags, all of that sort of stuff. I mean, having grown up in Kansas a little bit, I do understand where those people are coming from. So, you know, what are they protesting against?
They say they want the economy to open back up. They want restaurants to open back up. They want to be able to get a haircut and go to the casino and gamble. Those are the complaints we're hearing, and President Trump is sparring off with these governors on Twitter, and it's fueling hate, and that is going to be a key point in his re-election strategy.
So what is he actually saying to these governors? Is he trying to dictate to them that they should open up? Is he just playing to the gallery here while his medical people say something completely different?
Well, that's absolutely what he's doing, and we can only hope that's what's happening too, because we hope that there's people behind closed doors, off camera, making the sound decisions that we need to stay healthy, because a lot of governors say opening up right now is not what is appropriate, but we are seeing a slow transition in phases as they're doing, where they're allowing limited return back to work with social distancing and wearing face masks. But he is saying on Twitter, he's telling them to essentially rebel, and these governors are getting a lot of pressure. In some states, you can actually hear the protesters outside through the walls as these governors are giving their news conferences. And just yesterday, it got real nasty in one state where the state police had to step in.
And lastly, if you were a betting man, would you say that Donald Trump is likely to win? Would you put money on Donald Trump getting another term? Or I mean, how's that going?
I would say he has a very motivated voter base. So if he can keep the fuel on the fire, he is likely to win re-election. But Joe Biden is doing surprisingly well despite being held up in his basement in the state of Delaware. His numbers are going up while President Trump's are going down. I think the next 3 to 4 months throughout COVID-19, that's going to be crucial to see who is going to prevail in November.
What do people think that Joe Biden's got that Hillary Clinton didn't?
Well, he doesn't have much scandal despite the sexual assault allegations. He has more leadership in the White House than obviously she did as a spouse versus vice president. But we see President Trump, as he just attacked Hillary Clinton for years about her emails, he's attacking Joe Biden about his son Hunter Biden and some overseas business dealings that he had. So that seems to be what he's preaching on right now.
Lots more to come between now. Where are we? Can you believe it? We're in May. Lots more to come between May and November. It's going to be an interesting time. We will speak again, no doubt, and I look forward to it. Derek Myers, senior reporter for Newsnet. 7:30 is the time. Sunday morning here on LBC. The lockdown. I mean, would you go to a pub right now? No, I wouldn't either. But as we come out of this, what do you need to see for your job? What do you need to see for your life? Do you think your job will have changed? How will lockdown be for you? Or unlocking? In actual fact, 0345 606 0973 7:30 is the time. We will talk next to someone in a country that is going through the unlocking process. Spain started yesterday. It has been traumatic. We'll find out more about how they're handling things after the news with Bill Everton.
Boris Johnson's given more detail about his coronavirus treatment, revealing doctors had to plan having to announce his death. The Prime Minister told The Sun on Sunday he was told there was a 50-50 chance he might have to be put into an induced coma. 4 out of 5 people have told a survey for The Observer they don't want lockdown measures relaxed for pubs and restaurants in the next week. A different report in the Sunday Telegraph says ministers could reopen schools from the 1st of June. The number of people who've died with COVID-19 in UK hospitals, care homes and in the wider community is up by 621 to more than 28,000. And millions of people in the UK are soon going to be asked to use a phone app to stop the spread of the virus. It'll be used to determine if you've been in contact with someone who's been infected. The weather today, a dull and damp start to Sunday across southern England and Wales before things brighten up. Sunshine and showers for Scotland and Northern Ireland, and a high today of 16 degrees.
This is LBC. I'm Nick Ferrari, and I'm bringing you a daily podcast with insight into everything you need to know about the coronavirus outbreak as it rapidly develops. 1 in 4 are forced to reuse vital protective clothing. This is wholly unacceptable, isn't it?
People need to have the PPE according to the guidelines. The guidelines do say that in some cases PPE can safely be reused, and that's a good thing.
Coronavirus UK, an LBC daily podcast with Nick Ferrari. Listen now on Global Player or wherever you get your podcasts.
This is an important message from the government. For now, we must all still stay at home. It can be hard, but it's making a difference. So please keep going for the ones you love. Keep going for every key worker on the front line as they keep going for us. Keep going because together we will beat the virus. To all of you,